When recovering from illness or surgery, the difference between optimal and compromised recovery often comes down to personalized care. While hospitals provide essential medical treatment, research shows that private duty nursing can significantly improve health outcomes by preventing complications like hospital acquired infections and hospital dementia. Today, we'll examine the evidence behind these improved outcomes and why they matter for you or your loved ones. I'm Erica Frazier, founding member and director of growth at Navi Nurses. As a registered nurse who's worked in various healthcare settings, I've witnessed firsthand how private duty nursing creates measurably better health outcomes. Today, we'll explore the research-backed benefits of personalized nursing care and why it matters for recovery and long-term health. When we look at the scientific literature, the data strongly supports what we see in practice every day. Let me share some of the most compelling research findings with you. A 2018 Johns Hopkins study published in the Journal of the American Geriatric Society documented a remarkable 35% reduction in hospital readmissions for patients who received private duty nursing support during the first 30 days after discharge. Further evidence comes from the American Journal of Nursing Research, where a 2020 study revealed patients with private duty nursing experienced 28% faster functional recovery following orthopedic surgery. This translates to patients retaining independence and returning to their normal lives more quickly. Medication management shows equally impressive results. A New England Journal of Medicine study from 2019 found a 42% reduction in medication errors for patients with dedicated nursing oversight. Given that medication errors are a leading cause of preventable harm in healthcare, this improvement is substantial. Perhaps most striking is data from the National Institute of Health Research published in 2021, showing private duty nursing reduced instances of hospital-acquired infection by 47% compared to standard care. These infections can be life-threatening and significantly delay recovery. Private duty nursing significantly improves outcomes across multiple metrics. What's particularly striking is how consistent these benefits are across different populations and medical conditions. These aren't marginal improvements. They represent life-changing and sometimes life-saving differences in recovery experiences. Understanding why these improved outcomes occur helps explain the consistent benefits we see across diverse populations. Early detection of complications is a critical advantage. With continuous monitoring by the same nurse, subtle changes indicating developing problems are caught immediately, often before they become serious complications. Medication management prevents between 40 to 95% of adverse drug events. Private duty nurses ensure medications are administered correctly, identifying potential interactions, and recognize side effects requiring intervention. The continuous presence of a dedicated nurse creates a safety net that simply doesn't exist in other care models. The benefits of private duty nursing are particularly evident in specific health scenarios where personalized care makes a substantial difference. For post-surgical recovery, a 2022 University of Pennsylvania study published in the Annals of Surgery demonstrated a 29% faster return to independence with private duty nursing support. This improvement stems from several key nursing interventions: proper wound care that reduces infection risk by 38%, optimized pain management that facilitates earlier mobility, implementation of early mobilization protocols, and specialized respiratory therapy that prevents common post-surgical complications like pneumonia. In chronic disease management, a 2021 Mayo Clinic study demonstrated 41% fewer emergency visits for those with private duty nursing support. These nurses excel at monitoring symptoms and intervening early before conditions worsen, improving medication adherence, providing tailored diet and lifestyle guidance, and coordinating care across multiple specialties, creating a comprehensive approach that keeps chronic conditions stable. Individualized care planning customizes care to each person's unique needs, rather than following standardized protocols, resulting in 45% higher satisfaction and better engagement in recovery. Rather than addressing isolated problems, a private nurse creates a comprehensive safety system. This system prevents the cascading complications we often see in healthcare, where a hospital-acquired infection leads to delirium, which leads to falls, which leads to further complications. Breaking this cycle through attentive, personalized care is the cornerstone of improved outcomes. At Navi Nurses, we're committed to bringing these evidence-based benefits to people throughout Phoenix, Scottsdale, and surrounding communities. If you or a loved one are facing surgery, hospital discharge, or managing a chronic condition, don't leave your outcomes to chance. Visit navinurses.com to learn how our private duty nursing services can help you achieve better health outcomes through personalized, evidence-based care. If you found this information valuable, please like this video and share it with someone who might benefit from understanding how private duty nursing can improve health outcomes. Subscribe to our channel for more evidence-based healthcare insights.